Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Rousseau, and we have a unique show for you this evening. We're talking about pediatric services and the new children's hospital at St. Luke's University Health Network. Tonight, we'll be joined by a talented panel of experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at pediatric care offered at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Jennifer Janko, who serves as the Chair of Pediatrics for St. Luke's Children's Hospital. She earned her medical degree at Hahnemann University School of Medicine and completed her residency at St. Christopher's Hospital for Children in Philadelphia. Dr. Janko has special interest in vaccinations, nutrition, and child advocacy. She is certified by the American Board of Pediatrics and is a fellow of the American Academy of Pediatrics. Thanks for being here, Dr. Janko.
I'm so excited for tonight's program.
So how did you become interested in pediatric medicine, and what is your role as the Chair of Pediatrics and now with the Children's Hospital?
So true story, probably since about the age of 5, I wanted to be a pediatrician, and my kindergarten teacher can even attest to that. So I think for me, it was working with children that was most important in whatever capacity that was going to be, and then that became a little bit more defined in terms of becoming a pediatrician and working for children.
So you're someone who really knew and stuck with it.
I did.
That's so exciting.
I did, true story.
Joining our panel next is Dr. Christopher Plymire. He serves as the Medical Director of the Pediatric Intensive Care Unit and Inpatient Pediatric Unit at St. Luke's Children's Hospital in Bethlehem. He earned his medical degree from Thomas Jefferson University College of Medicine and completed his residency and a pediatric critical care fellowship at Nemours AI DuPont Hospital for Children. He's excited to work with the St. Luke's pediatric team to provide care to critically ill children in their own communities, close to home. Dr. Plymire, thanks for being here.
Thank you for having me.
Tell us how it feels to help care for some of the most vulnerable children and their families.
Working in the pediatric intensive care unit at St. Luke's is really unique and really special. We see such a wide variety of children, ranges from little children who just are a few days old having breathing problems to teenagers who underwent traumatic events. For many patients and many families, it's the worst day of their life. For something that we see routinely, it may be something that was such a terrible thing for them, and we're able to help them through that. So we use all of our team members, from our respiratory therapists to our great pediatric nurses to our team of pediatric hospitalists and intensivists, just to provide a great experience for them.
Let's meet our final panelist, Dr. Alana Arnold, who serves as the Network Medical Director of Pediatric Emergency Medicine at St. Luke's Children's Hospital. A native of Philadelphia, Dr. Arnold completed undergraduate studies at Princeton University and earned both her medical degree and MBA at Tufts University School of Medicine. She completed her residency at Children's Hospital Oakland and her Pediatric Emergency Medicine Fellowship at Texas Children's Hospital. Board certified in Pediatric Emergency Medicine, Dr. Arnold is a health education advocate and has worked to develop foundational curricula to boost health literacy and general interest in the medical field for the most vulnerable children's populations. Dr. Arnold, thank you for being here.
Thank you so much for having me.
So as the Network Medical Director of Pediatric Emergency Medicine, tell us what drew you into specifically emergency care for kids.
I was always interested in emergency medicine. I love doing procedures. I love the variability of the pathology that you see in the ER. And so when I was in medical school, I knew that I wanted to do emergency medicine. When I did my rotation with adults, though, that was kind of challenging. A lot of times the adults don't listen to the medical advice, so it wasn't as rewarding. So I pivoted and pursued pediatric emergency medicine, and I've loved it ever since. Children are very resilient, they're fun-loving, honest, and it's always an enjoyable shift, and you get to see really cute babies, so that locked me into the specialty.
Thank you all for giving us some background information, but we're not done yet. Next, we're going to dig deeper into current pediatric services offered at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Membership in the Children's Hospital Association can benefit everyone who's caring for children.
We have access to resources that we might not otherwise have.
Each floor is uniquely themed and interactive for kids to be comfortable in a setting that can sometimes be anxiety-provoking when you're outside of your home.
First and foremost, children are our future. So if we want a healthier tomorrow, if we want a healthier generation going forward, it starts right now.
Child life specialists are trained in the developmental impact of illness, injury, and hospitalization. And so we take what we know about child development and then we apply that to the healthcare environment to try and mitigate the stress of that experience for pediatric patients. Child Life Services started in January 2023. So we're really trying to expand the reach of Child Life and kind of enhance that psychosocial support to patients all throughout the network. We know in the literature that kids cope better with stressful experiences when they know what to expect. So that's part of my role, is to provide that teaching to patients. My interventions look different depending on what their needs are, but I might be engaging in therapeutic play to help our little ones kind of understand and process what's happening to them while they're in the hospital. Everyone is so dedicated to making this a bright and positive experience for our kids. If we can empower a kiddo to have a positive experience while they're with us, that's going to travel with them through their healthcare encounters for the rest of their little lives.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank you, our viewers, for watching our program tonight and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals, Dr. Jennifer Janko, Dr. Christopher Plymire, and Dr. Alana Arnold. We've learned a little bit about your expertise, but now we want to dive a little deeper into pediatric care at St. Luke's. So, Dr. Plymire, I'm going to start with you. What ages do you see in the pediatric intensive care unit and the inpatient pediatric care unit? Because they can be a wide range. And what kinds of common conditions or injuries do you see there?
So in both the pediatric and inpatient floor, we take care of children from the moment they go home from the hospital up until the time they turn 21. The most common things we see are related to either illnesses or accidents that happen in children. It's very common for small babies to have trouble with their breathing. Last fall we saw a lot of RSV, which you may have heard about in the news. We see children with COVID, children with influenza very commonly. In our area, asthma is another very common contributor to illness in children, so we take care of a lot of children with severe asthma exacerbations, and we work with our specialists to help with all of these conditions. Those are our three most common diagnoses, but it can be anything from a car accident, a broken leg, up until just normal breathing problems in kids.
Well, Dr. Arnold, I want to ask you, what differentiates a pediatric emergency department from a regular emergency department, and what can families expect when they bring their child into St. Luke's pediatric ER?
A pediatric ER has pediatric ER trained clinicians. To give you a bit of background, for example, myself, you have to go through residency for pediatrics and then do subspecialty training called a fellowship to really specialize in pediatric emergency medicine. Typically, that's a 3-year program, and if you do emergency medicine residency, it's a 2-year program. So you really hone your skills in treating children in an acute care setting to make sure that you can understand the pathology that's going on and be ready for whatever comes through the door. At St. Luke's, they've been focused on building a team to make sure that they're prepared for the patients that they're going to be seeing. So it's a full complement of pediatric nurses who are trained and well-versed in caring for kids, as well as ancillary staff such as child life specialists who help with family care for the kids as they come in around perhaps a procedure and helping them understand what's going on. So those types of things have really made St. Luke's a great asset to the community.
You mentioned how much the department has changed. So Dr. Janko, I want to talk to you because you've been the chair of pediatrics since 2012. It has changed exponentially. Can you tell us a little bit more about what's been added and what's available to families in the Lehigh Valley if they come to St. Luke's?
So if you've been in the Lehigh Valley for any period of time, you may have been seeing these changes happen incrementally, a little bit as we go, but we've changed in just about every way. So the services that we have provide almost anything you might need for a child, whether it's for preventative services or acute care services. So to start, we have pediatric primary care offices in all of the counties that we serve and all of the communities that we serve. But we've also added things, as you've heard from Dr. Plymire, a pediatric intensive care unit to be able to take care of the children in the unit unit, along with the pediatric intensive care doctors, we have a full array of specialists, and that ranges from surgical specialists like pediatric surgeons, pediatric orthopedics, pediatric ear, nose, and throat doctors, to general medical pediatric specialists. So all encompassing, we have about 40 different areas of pediatrics that our patients and our families can expect to be able to use the services from. There's labs in the community just for children. There's the ER, like Dr. Arnold referenced, lactation services, and some of the services are the only ones in the area. You know, our dialysis program, we're the only one around. We have developmental pediatrics. It's the only one in the region. Lactation services. So a lot that this is the place to come if you have a child.
It's really amazing to see how it's grown and to know for families they can stay right here at St. Luke's and get the care in their own backyard. You know, Dr. Plymire, you mentioned the team approach and how important that is, especially in pediatrics. Can you talk to me about the nurse-to-patient ratio and sort of that atmosphere that families can expect when they come in, the kind of care that they can get when they are with you and your team?
One of the nicest things about our new units is that they were designed exactly with families in mind. So from the visitation hours to the lounges available to them and to the actual physical space themselves, where they have a place that's isolated but they can stay right beside their child and spend the night if needed. In terms of the nurse-to-patient ratio, the ICU typically staffs with 1 nurse for every 2 patients. In the inpatient floor, where you may not need quite as much attention, we typically staff with 1 nurse for every 4 patients. Patients are always centrally monitored, and there's always either an intensivist or hospitalist in the house just to make sure that everything is safe and everyone is doing well.
Dr. Arnold, every parent hopes their child never ends up in the emergency room, and sometimes even something that might seem very simple medically seems very traumatic for a family. I'm wondering, what are some of the main medical conditions and concerns that you see, and how do you sort of ease the anxiety of families when they come into the emergency room?
Yes, so you're absolutely right. I always tell my friends that I love to see them, but hopefully not at work. And so it's understandable that coming to the ER can be very traumatic for the families. So first thing, you want to make sure that you connect with the family to put them at ease. As you mentioned, sometimes it might be a minor medical issue, but for them it's very traumatic. So many of the common things that we see are respiratory illnesses, as Dr. Plymire alluded to. It's very common in children, so asthma or other breathing problems, for example, or any orthopedic injury as well, because kids are very active, so they're always breaking things and getting into a little trouble. Apart from that, we do see a full range, so it could be anything from cardiac issues, kidney, other parts of the body that are involved in terms of organ systems, but I would say probably respiratory illnesses, traumatic injuries, and lacerations, cuts and bruises, things like that are very common that we see.
Great information from all of you, but we're not done yet. After the break, we'll learn more about specialty pediatric services and the new Children's Hospital at St. Luke's. You're watching St. Luke's Health Now. Stay tuned.
It's here! For real! It's St. Luke's Children's Hospital, ready to help all kids. They're keeping kids healthy, fixing us up, making us feel better, helping kids be the best they can be, because it's about us, the kids. It's St. Luke's Children's Hospital!
St. Luke's Children's Hospital is helping kids with everything, from routine checkups to specialized care.
It's here! It's great! Yeah!
Hi, my name is Jennifer Orcholi. My daughter Sophia was born prematurely at 27 weeks and 4 days at St. Luke's Hospital. She spent 59 days in the NICU, and it was truly an emotional roller coaster. We had excellent care. We got to know the nurses and the doctors and the therapists. I definitely had the comfort of knowing that she was in really good hands while she was there. So she's 3 years old now, and we came down with the rhinovirus. It hit Sophia really, really hard. At that point, I took her to St. Luke's Bethlehem. Soon after, we were in the pediatric intensive care unit. The care that we received at St. Luke's was just honestly phenomenal. As a parent, it's very easy to feel like you're not involved with the care because you're not the professional. Dr. Plymire was just so comforting with his words, knowledgeable, made sure that I was comfortable with her plan. The team in the pediatric unit at St. Luke's was wonderful. I'm just so forever grateful for the care that she received. I'm so grateful to know that should something happen in the future, that we have a team that will have her back, that will give her the best care possible. When she was born, I was so afraid of what our outcomes would be, and to see the little girl she's becoming is everything I could dream of. So I'm really proud of her.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a really interesting show tonight. We're talking about pediatric care at St. Luke's University Health Network. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Janko, Dr. Plymeyer, and Dr. Arnold. Thank you all for being here. First part of the program, we talked about your expertise, your interest in pediatrics, and also some of the services offered at St. Luke's. But I want to dive in a little bit more about specialties that are offered. So, Dr. Arnold, I'm going to talk to you first. So what are some of the specific qualifications at this pediatric emergency department in managing like the emergency medical needs for newborns to teens? You talked about your training earlier in the show, but tell me a little bit about the rest of the staff and how people are trained specifically to deal with emergencies and kids.
Yes, so it's really important to make sure that the staff are well trained in interfacing and interacting with kids. It can be very traumatic for a child and the family as they come into the ER. So you want to know how to approach a child, right? So the way that I would talk to a toddler is very different from the way I would talk to a 16-year-old. So having that background training is really important so that you can connect with the families and make sure that they're comfortable when they're seeking their medical care. So sometimes, for example, if you have to get an IV or something like that, that can be very challenging for a baby, for example, you want to make sure that your team is well prepared and well trained. So that's been something that has been approached and vetted in terms of the education for the nurses. And then ancillary staff like respiratory therapists and child life specialists who are going to help interface with the families depending on the needs of the care for the child.
Dr. Plymeyer, I want to ask you a little bit about critically ill children. That's something you hope you never have to face, and certainly something that you hope there's good care involved. So you've got things like pediatric intensivists, pediatric hospitalists, and pediatric nurses. Can you tell us what those roles are and how they integrate to provide really high quality care at St. Luke's?
Absolutely. So in the intensive care unit, you could see generally 3 types of people. The first is a specially trained pediatric respiratory therapist. So if a child's on any sort of supplemental oxygen, on any sort of ventilator, on any sort of breathing device, they help us manage that and help us do it in the most comfortable way for kids. The next 2 people you see are either a pediatric hospitalist or a pediatric intensivist. Our pediatric hospitalists are all either board certified or board eligible in pediatric hospital medicine, and they're all experts in general day-to-day care of acutely ill children. Whenever children need a little bit more support, that's what our pediatric intensivists are for. So those are people that have done 3 years of training just in the sickest of children and all the things that we can do to help them. So they can do procedures to put them on a ventilator, procedures to help with their blood pressure or their heart rate, and things like dialysis if their kidneys started to fail.
It's incredible to me how specialized each one of the people in this area has to be. And you've added something even more special, Dr. Janko, which are child life specialists. What are those people? What is their job, and how do they help with these critically ill children and their families?
Child life specialists are an important member of the team, and we've heard about the physicians and the nurses and their qualifications and training, which is very important. But as Dr. Alana Arnold said, you have to know how to approach this family. And for any child in any family, being in the hospital setting is traumatic, and even if it's for a routine scheduled thing. So what the child life specialist does, they're a member of the team, and they will come meet with the child and meet with the family, understand what their fears and anxieties are, and work with the doctors and the nurses to be present and part of the treatment plan for that child, whether that's answering questions in a developmentally appropriate way, having appropriate distraction techniques when they're undergoing procedures, but they're a key member of the team, which is all part of the philosophical approach of tailoring the way that we interface with children.
I would imagine that would be incredibly helpful. So Dr. Arnold, when you and your team are preparing to do something in the emergency department that you know might be scary, might be painful, how do you interface with the child themselves to help prepare them for that circumstance, and maybe sometimes prepare the parents, because sometimes the parents are more concerned than the kids?
Yes, I'm glad you brought that up. So I really just try to read the room. So as you just mentioned, sometimes the child is more relaxed and calm, and it might be the parents that are more anxious. So you have to approach them kind of in a way where you recognize and understand that they're going to be anxious, but also walk them through what's going to happen. I always say to the kids, like, I'm never going to lie to you. I'm going to tell you exactly what we're going to do, why we're going to do that, and kind of prepare them for what's coming next so that they're not blindsided or extremely anxious about it. Often with the families, you want to make sure that they understand that their child is your priority and that you're focusing on getting them better and working with them in terms of their own anxieties or prior experiences that may not have been so great, but kind of bridging that gap to make sure that they're on the same page with you as you deliver the medical care for their child.
When you're delivering that medical care, sometimes, Dr. Plymire, those things are actually life-saving technologies and procedures. So tell me how St. Luke's PICU compares to other children's hospitals around the country, and what kind of services can you offer that maybe are pretty special to St. Luke's in the Lehigh Valley?
So compared to 10 years ago, we have so many more options to help children, especially with their breathing. So 10 years ago, we could essentially offer just regular oxygen or put a child on a ventilator. Now we have a ton of different modalities ranging from higher flow oxygen to BiPAP, like older people sometimes use for sleep apnea, all of which are very comfortable to deliver in children and very effective. So most children we can actually keep off of a ventilator. Here at St. Luke's, we're fortunate to have great pediatric cardiologists. So for children that either have problems with how their heart beats or how their blood pressure is, we can use our cardiology colleagues to help treat them and make sure we can keep them safe and get them better. We're very fortunate to have the only pediatric nephrologist in the area. So for a lot of children with complex kidney disease, they either need dialysis emergently or dialysis on a regular basis. And here we can actually do that as both an inpatient and outpatient, which is very unique for a pediatric center. We are also associated with a great counterpart of pediatric neurologists. So seizures are very common in children and very, very scary. And we have all the equipment necessary to diagnose them, whether it's an MRI, an EEG, or just the expertise of a neurologist right here in Bethlehem.
Dr. Janko, St. Luke's is a member of the Children's Hospital Association and has just announced the St. Luke's Children's Hospital. Very exciting. Why is this so important to families in our community?
The Children's Hospital Association is really your who's who of pediatric hospitals, of children's hospitals. And what that means is we're not just one entity with our own internal way of thinking and doing things, but we are now connected throughout all children's hospitals across the United States. So we can share best practices. They can learn from us, we can learn from them, we can develop better quality, and that's what we're all about. We're not just about places where you can bring your child. This is where you should bring your child because you're going to get the best care. And the way we know that we're going to keep up with that is by staying current, by being part of Children's Hospital Association.
That is an incredibly important differentiation, so thank you so much. You guys have given us such an engaging conversation, so up next we're going to get questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's Pediatrics delivers everything from checkups to specialized care, all conveniently located close to home, so kids will have happy, healthy childhoods. St. Luke's Pediatrics, caring for your future.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about pediatric care at St. Luke's University Health Network. Now we're going to read some questions from our viewers. You guys ready?
Absolutely.
All right. Dr. Janko, why is it necessary for St. Luke's to have a children's hospital?
The community needs a children's hospital. I trained in Philadelphia where there was lots of choices for pediatric care. And when I came to the St. Luke's area, it was amazing to me that people were traveling great distances for things that really should be able to be cared for in somebody's community. That's a difficult situation that doesn't need to be. So I think this is really what the community needs. There's children that live in this community. Everybody I know has kids around here is so excited to be able to get the care that they know from St. Luke's and now be able to get that for their children.
Absolutely, and it alleviates so much stress on the family. All right, Dr. Arnold, I think this one is for you. I have a healthy 7-year-old daughter. Last winter, she developed a 104-degree fever that really scared me. How long does it usually take for fevers to break? And at what point should I consider taking my child to the emergency department?
What I would say, and the disclaimer is that I do not know this child, I haven't cared for them. But what I would say is that most children who are healthy having fevers is a completely normal part of getting over an infection. So it could be a virus or a bacteria, depending on what's going on. And so if the child has a fever for a few days, that's expected because their immune system is responding to that pathogen in their body. If you know that your child is not looking well or not responding to Motrin or Tylenol, try to make an appointment with your primary care physician, and if you're unable to do that, then certainly come to the emergency room and we're happy to see you, because I know that it can be very anxiety provoking for the families to not be able to get into appointments and whatnot, so we would be happy to see them in the ER.
All right, Dr. Plymire, this is for you. As a parent of a child who has serious medical issues, it's good to know that St. Luke's has a PICU. It's close to our home and our family. What type of considerations are made for children and their families who have prolonged stays in this unit? That's a really good question. What if you have to stay more than a couple days?
So I think the biggest benefit of how our units are designed is that both the pediatric floor and the pediatric intensive care unit have a great setup for our families. So they have a separate television, they have a separate bed where they can spend the night. We don't say at 8 p.m. you have to leave. You're welcome anytime to come, and we want you there. We are very fortunate that the physical space is great. It's very child friendly. We have lots of toys and great support from our community. So for what's usually a very stressful time for families, the experience is usually very great. We also can usually interface with multiple specialists if they need it and get their appointments scheduled while they're still in the hospital. So what is initially a hospitalization will eventually need outpatient follow-up, and we can usually coordinate that at our specialty center just for one day so that the family doesn't have to make multiple trips.
Making it super easy. All right, Dr. Janko, I think this is for you. Okay. If my child needs more than just a regular pediatric care and they need something with specialized medicine or surgical care, how is that coordinated through the pediatricians?
So my goal as a primary care pediatrician is to honestly keep them out of the ED and keep them out of the hospital. I think that's the parent's goal as well. So a lot of these things through preventative care visits, when you come, we can identify conditions in an earlier state, and then as the primary care doctor, I see myself as the captain of the ship. So what I do, and I'm kind of co-partnering with the parent on that, but then I would say, okay, listen, you need to see, if I hear a heart murmur, a cardiologist, or if the asthma is poorly controlled and you need to see the pulmonologist, or maybe you're one of our NICU babies who was born premature and has multiple medical problems. And there are plenty of children like that in the community that have a lot of complex medical needs. Not that they need inpatient, but they need coordinated outpatient. Then we rely on our team of specialists, and that's where we use our pediatric specialty center, which is one building with multiple specialists. And the idea is that we'll coordinate that. I'll basically phone a friend, call my colleagues up, and help coordinate appointments for you.
Yeah, coordination is absolutely key, absolutely. All right, Dr. Arnold, another one for you. My 10-year-old son was just diagnosed with asthma and thankfully has only had mild flare-ups so far. But when would an asthma attack in a child warrant a trip to the emergency department?
First off, it's really important for the family to have what we like to call an asthma action plan. So typically this is coordinated with the primary care doctor, and it's basically a stepwise approach to manage the asthma. So typically, for example, if the child's doing fine, you would be in the green zone. It's kind of a traffic light system. If they start having symptoms, for example, they would move into the yellow range, and that's when they should start using their medications, and then at that time call or try to make an appointment with their primary care doctor. If they're unable to get into an office or there's a delay in care, then that's when they should seek medical care at the emergency department. And obviously if they're having difficulty breathing, they should certainly call 911 to get them there immediately.
Dr. Plymire, this is the last question I have for you. When would a newborn baby be admitted to the pediatric intensive care unit instead of the neonatal? So people have heard of NICU, neonatal intensive care unit, but now we have a pediatric intensive care. What's the difference, and when does a newborn go to each place?
So in general, neonatal intensive care units care for children right around the time of childbirth. Whether they were born prematurely, whether they had trouble with feeding, whether they had trouble with jaundice, those children would go to one of our 3 NICUs in the area. After children go home from the hospital, in general, they come back to our pediatric intensive care unit. So even if a child had an infection right after they went home or developed RSV or another breathing problem, they would come to our pediatric intensive care unit rather than the neonatal ICU.
All right, excellent. Great information from all of you. Thank you so much. You are a superstar panel, and we appreciate all of the information you shared here with us today. For more information on pediatric care at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.